Introduce yourself to your neighbor if you don't know them yet.
So we're marching today because healthcare is a human right.
Healthcare is a human right.
It's going to be leisurely. We're going to dance in the street, all right?
Yeah!
Healthcare is a
Human right!
healthcare is a
Human right!
healthcare is a
Human right!
Welcome everyone to Barre. I've had the privilege of being the pastor here at the Presbyterian Church for a number of years. And one of the great joys that we have here is that we get to host the Vermont Workers Center and all the good work that they do right here in Barre, which is home to a lot of community organizing and solidarity work over many, many years. A couple VIA folks were traveling in the sunny, warm African country of Morocco. And while they were traveling around Morocco, they learned about a lot of the challenges that folks face in Morocco, things like illiteracy, things like poverty, things that keep people down for too long. And they had a guide whose name was Hamad, who was leading them around Morocco. And as they were face to face with a lot of the poverty in that community, they asked Hamad, what do people do when they need health care? And you know what Hamad said in this developing country? He said that in Morocco, we provide health care for every single citizen of our country.
Well, let's go.
So then Hamad asked my friends, Mary Beth and Tom, if there was universal health care in this country, the United States of America, the wealthiest country in the world. And you know what they answered, right? Is there universal health care? No! Which is a problem.
Yes.
Health care is a
Human right!
health care is a
Human right!
Everybody's got a right to live. Everybody's got a right to live. Whole thing.
People power on the rise. Now it's time to organize. People power on the rise. We march side by side. We're fighting for our
Thank you.
silent anymore.
And by the way things are going in this economy for farmers, my situation ain't going to change anytime soon, so I desperately need Medicaid, and I need way more than Medicaid.
Now, I have a defibrillator, which they stuck in my chest, so I have to be monitored every 3 months. Took me a couple months to get Medicare, so that was kind of airy. Now, without my Medicaid, I would not be able to have my defibrillator checked every 3 months. And that is the reason why I fight for Medicaid.
Good afternoon, everyone. My name is Hannah. I'm here today marching for Medicaid because working as a healthcare associate here in Barre for a resource desperately trying to maintain access for reproductive health care. You and I are walking dollar signs to the people that profit off of our current system. And I, for one, refuse to accept that politicians and billionaires have the right to tell me that my life and the lives of the people that I love aren't worth the risk to their profits. All of these reasons and so many more are why I am marching for Medicaid.
My name is Donna. I'm from the Northeast Kingdom. My mother was on Medicaid. She was a bad diabetic. very bad diabetic. Now I have diabetes. It's not quite as bad as hers, but I wouldn't be able to afford my anti-diabetic medication or anything else if it wasn't for Medicaid.
I'm marching for Medicaid because as a single mom of 3 children, working 2 jobs with neither one that provides health insurance. Before the divorce, I received my ex-husband's Cadillac insurance, and without Dr. Dinosaur, I'd never be able to meet my children's healthcare needs. I have a son with ADHD that requires daily medication and monthly doctor visits combined with therapy. My children's right to adequate health care is why I'm marching for Medicaid.
I'm marching for Medicare because coverage is always dropping. I can go to the eye doctor, but they don't help cover eyeglasses. I paid $300 for these. Dental coverage is only $500 a year. Sometimes they'll give you a voucher if you need more, if they have the money. We go without, but all our government officials are totally covered. Are they better than us? No.
Hola, mi nombre es Miguel. Soy trabajador de la industria lechera del estado de Vermont, ayudando a mantener y a sostener la lechería.
Hi everyone, my name is Miguel. I'm a dairy farm worker here in the state of Vermont, helping to maintain the dairy industry and the family brands of ice cream. I'm also part of Migrant Justice. I work on a farm. It's one of the most difficult jobs there are. It's dangerous due to the large and heavy animals because you can get hit by the cows or crushed by the cows. Also, the machinery is very dangerous. If you get distracted, you can easily get into an accident or even lose your life. The chemicals are also very dangerous. You have to be very careful when you handle the chemicals. If a little bit of acid drops on your eye, you can lose your eyesight.
Si el ácido te cae en la vista, puede quedar hasta ciego.
Recently, I was working on the farm when I was pushing cows, and a bull came right up behind me and hit me on the back. I couldn't get up or I couldn't move, so my co-workers helped me to get up and help me move. Right now, I'm recovering from that injury. Something that really helped me was the workers' compensation. It helped me to giving me part of my wages. I was really lucky. My reality without workers' compensation would have been very difficult because I wouldn't have been able to work. That would have affected my family. My family depends on me. Medicaid is really important because if you have an accident outside of work or anyone has an accident outside of work, you will have the medical support. You don't have to pay that much money when you go to see a doctor. This will help me and my fellow co-workers, and because instead of spending so much money, I will use that for things that I need. I wouldn't have to choose between my family and my health. It will be great that this law continues to move forward and continues to stay strong so that we all get the medical coverage that we need.
Vermont's NEA Teacher Union is joining the struggle for healthcare for all. As teachers and support staff, we love the young people under our care. Any cuts to Medicaid, small or large, harms our students' learning, which directly impacts our teaching conditions. Teachers and support staff unions must fight for the public good, healthcare for all, as well as education, housing, and food, because these are the foundations to health. All people deserve healthcare now. So when healthcare is under attack, what do? Stand up, fight back. When healthcare is under attack, what do? Stand up, fight back. Thank you.
I work primarily with involuntary patients at the Brattleboro Retreat. Many of the patients staying at the hospital involuntarily were brought in following a stressful incident involving money. Having to choose between basic staples of living, health, and psychiatric care is a tightrope that no one should be forced to walk. But I meet people every day at work who fell off through no fault of their own.
Yeah, my name is Volney, and I'm here to call for the protection and the expansion of Medicaid, not only as a Vermont Workers Center member, but as somebody that's gone through the Medicaid system and experienced the benefits and the shortcomings. I've had a long, lengthy battle with cancer, in which I heavily relied on the Medicaid system, and once I was in it, I realized that it didn't cover most of the things that I would need. My story's not unique, and there are people all over that have to go through the same problems, and I feel like everybody in every state all over America shouldn't have to worry about their health care, and not only for them and themselves and their families, but also the people in their community. So I'm here to call for a protection and expansion of Medicaid, and that's why I'm marching.
I am marching for Medicaid because mental health issues are a big part of universal health care. In order to live a normal life, we need this insurance. So, health care is a human right. Everybody say it. Health care is a human right.
That's really hard. People getting real vulnerable. This is real stuff we're talking about. People are really suffering. We are really suffering. Our family members, our neighbors, our coworkers are really suffering under this unjust system. And I think our friend Becca here said it best, that profit, that's what's up. That's why things are so bad, because there are so many people trying to make money off of our bodies. And that ain't right. You know, we're at a real crossroads in this country. We can either decide as a nation that we're going to guarantee health care for everyone, guarantee it for everyone regardless of their immigration status, regardless of the color of their skin, their pre-existing conditions, how much money they make, if they were born into the right family and in the right neighborhood, or their gender.
Well, you better believe it's going to take getting beyond human right to health care too, because we're going to fight for our right to housing, to food, to clean air and water and dignified work. We're going to fight for the rights of people who are different than we are, because at the end of the day, what unites us all is that we live in the wealthiest nation in the history of the world. Yet there are so many of us struggling just to get by, while the rich keep getting richer off our backs. 1,500 patients go to this office, to this primary care facility, and at least 150 or 200 walk there. So if it closes and it's the only downtown office, what is going on, folks? Rural hospitals are closing. These primary care places are closing in smaller towns. And then I hear there's some kind of expansion happening in Burlington.
But there's, you know, the important thing is today, this is not the end, right? It's not the beginning. People have been engaged in this fight for a very long time, but it's also not the end. This is not about a single event. This is about a process of organizing a robust, gigantic movement of poor and working class Vermonters who are going to fight for healthcare justice. We're going to fight for migrant justice. We're going to fight for disability rights. We're going to fight for gender justice and reproductive justice. And we're not going to stop until we win it all, right? All right? So what do we say? Forward together, not one step back. Forward together, not one step back. Forward together, not one step back. Forward